I think tumor mutation burden is emerging as the other major biomarker for response to immune checkpoint inhibitors. Aside from PD-L1, which has already been established and is more widely utilized. I think we'll be seeing increasing interest in tumor mutation burden, and there's going to be more work done on there needs to be more work done to understand how to integrate TMB with PD-L1 status. So in order to identify the patients with the highest likelihood of response to immune checkpoint inhibitors and the patients with the lowest likelihood of response. So in that context, I thought there were two interesting abstracts presented here this year at ASCO that really surveyed TMB status across different cancers. One of the studies that was presented here is a large retrospective study of atezolizumab response in relation to tumor mutation burden. So retrospective analysis of tumor mutation burden across several monotherapy studies. I think the total number of patients was over 900 patients in this retrospective analysis. And it showed that response to this immune checkpoint inhibitor was correlated with tumor mutation burden. And this is tumor mutation burden based on tissue testing. So testing of the tumor biopsies using, I believe, the Foundation 1 assay, which is a tumor-only NGS assay, large panel NGS assay. And the response, the likelihood of response was correlated with the TMB, not just in terms of a cutoff, but also in a continuous fashion. It was also correlated, as expected, with neoantigen load. So obviously, the more mutations you have in the tumor, the more there's an opportunity for the creation of neoantigens that are recognized by that patient's immune system. So I think it was a very interesting study and really points to how tumor mutation burden is a very important factor in response to immune checkpoint inhibitors. Another study that I thought was quite interesting looked at breast cancer specifically. So breast cancer has been kind of left behind a little bit in terms of immunotherapy. And this study looked at tumor mutation burden in breast cancer using publicly available genomic data from AACR-GINI and TCGA and other large studies, including data from our own MSK Impact database. And across a very, several thousand patients, several thousand samples, they found that the proportion of patients that were considered hypermutated, and they used a relatively low cutoff of 10 mutations per megabase, was 2%. So it really points to the fact that breast cancer is not really a high TMB cancer. On the whole, the percentage of breast cancer patients, as shown by this study, the percentage of breast cancer patients with high TMB, therefore who would be attractive immunotherapy candidates on that basis is low. My take on tumor mutation burden as a biomarker is that it is providing one more reason, one more rationale to perform fairly large-scale, large panel NGS testing of patients with advanced solid cancers, because we're already doing this kind of sequencing to identify targets for targeted therapies. Now, from that same sequencing, we can get additional information like tumor mutation burden that's going to help to identify patients who are most likely to respond to immune checkpoint inhibitor therapy. So I think we need to, I think it'll lead to the establishment, the further establishment of this type of upfront large panel NGS-based testing in many centers across the world.